The second month of pregnancy is known as the survival phase. This is because your body is fully adjusting to pregnancy, and so your hormones, your symptoms can be all over the place. So we're going to be dividing what happens in the second month into 3 phases. The first one would be about what happens in your baby. The second one would be about what happens in yourself. And the third one is going to be about what you can expect when you go for your prenatal appointments. So let's start off with what happens in your baby. In the second month, your baby's organs are fully developing. They are in full construction, from their brain to their spinal cord to their liver, their hearts. Basically, every organ is fully developing. There is also another organ known as the placenta. The placenta is what attaches your baby to yourself inside your uterus, also known as your womb. So the placenta hasn't fully developed at this stage. It's still in the process. So it's not really supplying nutrients and oxygen to your baby. The thing that does that is called the yolk sac. So at the end of the second month and beginning of the third month, that is when the placenta has fully developed and then begins supplying everything that is essential for your baby to thrive. So another thing that can happen in the second month is that your baby is very tiny, about the size of a bean. Yes, that bean, that is how small your baby is. This is also the stage when your baby's neural tube closes. From the name, neural simply means a collection of nerves. So it gives off your baby's brain and then their spinal cord. So let's move on to what happens in you as a mama to be. Yes, let's start off with your symptoms. I've talked about the symptoms you can expect in this video here, so please check that out. However, in the second month, most of these symptoms can escalate. They can really go haywire. So if you've been experiencing fatigue, nausea, vomiting, they're most likely going to get worse during the second month. There are some other symptoms as well, like peeing more frequently. So the bathroom is going to be your best friend because your kidneys are getting a lot of blood at this time. So they're filtering, they're overworking themselves basically and producing so much urine that you'd be rushing to the bathroom every now and then to pee. If you're at work, your colleagues might even be asking you, why are you going to the why are you going to the toilet to go and pee so often? You just went 5 minutes ago and you're already going now. That is because of your hormones. Your hormones are doing so much to you. Then you could also start getting cravings and food aversions. So what are some things that you can do to ensure that you and your baby are fine during the second month? And this forms a foundation for your pregnancy. So number one is, and this is like one of the very important ones, not like any of them is not important, but this one is very important. So you need to start taking prenatal vitamins. If you've not started in the first month, this is the month when you would most likely want to start that, because the folic acid and every other thing, but that folic acid really helps in your baby's development. Because like I said earlier, your baby's organs are in full construction. So they need fuel, and the fuel comes in the form of folic acid. That is one of their main sources of fuel to ensure that their organs are fully developed well, so that when your baby comes out, they don't have any abnormalities. It doesn't necessarily rule it out 100%, but it really helps to prevent any form of abnormalities. So that is number one. And then aside from folic acid, there are some other important nutrients that you need, and these include iron, vitamin D, calcium as well. So these ones are very important to ensure that both yourself, not just your baby, but both yourself and your baby are fine. It's also important to stay nourished because you need your strength to be up. So eat small frequent meals, especially if you're having nausea. But if you're not, you can eat as you used to. But for pregnant women who have nausea, it's best to eat small frequent meals, so you can spread your meals out over the day. Eat like 6 times, 7 times, 8 times, whatever works for you is best. And then stay hydrated. Okay, so dehydration can worsen nausea. That's why drinking at least 3 liters of water a day, I know that's a lot, especially if you're not really the water drinking type, but I mean your body is going through a lot of changes. So drink up all that water because it has so many benefits for both yourself and your baby. Still talking about foods, there are some foods that you want to avoid. So anything that is raw, like raw milk, raw eggs, raw fish, raw meats, a lot of raw vegetables. There are some that are still okay to eat after washing them and maybe steaming, but most things that are raw, you want to stay away from them because they have a lot of harmful germs that can hurt you and your baby. Then another thing you want to do as well is to rest. So this might not really be possible if you're having insomnia, because insomnia is one of the symptoms that you can begin experiencing. Insomnia simply means difficulty falling asleep or staying asleep. So if you're experiencing this, please talk to your doctor, your midwife, and they will definitely have a way to help you out. But I have a video coming up that talks about ways to manage the common symptoms or the common discomforts that most pregnant women experience. So if you're interested in that, please do well to subscribe so that you don't miss out on that video. So it's best to get 8 hours of sleep every night. This might increase because one of the symptoms you could have during pregnancy is sleeping a lot. So if your work permits, you might find yourself sleeping maybe 16 hours a day, 20 hours a day out of 24 hours a day. Yes, it's possible. Pregnancy can do that to you. So just listen to your body and do what your body wants you to do. Okay, so let's move on to the third thing. So let's move on to the third aspect. So let's move on to the third phase of this topic So let's move on to the third phase of this topic, which talks about what to expect during your prenatal appointments. So number one is when you get to the clinic or to the hospital, they're going to take a history from you. And some of the questions they'll be asking you is when you had your last menstrual period, if you've ever been pregnant, if you planned to have your baby. One of the reasons why they ask that last question, if you plan to have your baby, is there are some people that didn't plan. They call it the accident pregnancy or the accident baby, and this can affect their mental health because they were not mentally and emotionally, maybe even financially ready. And when the healthcare team gets to know that you didn't plan to have that baby, they could offer some additional support like finances, mental health counseling, things that will just help you thrive. They're also going to ask about your past medical history, if you have any medical conditions that they need to know about, if your family has any history of any medical conditions, if there were any diseases when any of your family members were pregnant. So the idea is just to get to know you medically and then be able to draw up a plan that suits you. So by now you would most likely have done a urine test at home to confirm that you're pregnant. However, when you get to the hospital, in most places they would usually take your blood sample and even ask you to pee so that they can test if you're actually pregnant. So after they've confirmed this, then they would book you in. But before they do that, if you've forgotten your last menstrual period or you were not really sure about when you had your last menstrual period, they are going to do what we call a dating scan, which helps them to know when you conceived and then be able to calculate your gestational age, your baby's gestational age. That is how old your baby is. So if your baby is 4 weeks, 5 weeks, 6 weeks, whatever the case is, and then also calculate your EDD. EDD is estimated date of delivery. So that is when your baby is most likely to come into the world. Another aspect of your prenatal appointment is that you would have general health checks. So what happens in these checks is that your weight will be taken, your height would be checked, and your BMI would be calculated. So a BMI is known as body mass index, and that helps tell your healthcare team if you are overweight, underweight, obese, or normal. So whatever the case is, they're going to advise you accordingly. Then another thing that would be done is your blood pressure would be checked. You would be asked to pee in a bottle so that your urine can be checked for different things like sugar, protein, ketones. You know, these are things that just tell us if you are prone to having any kind of complications like preeclampsia. Preeclampsia is a condition that could cause high blood pressure and protein in the urine in pregnant women, and this can lead to a lot of things. So we don't want that. That's why knowing ahead of time if you could develop this kind of conditions is really important. The next thing that you can expect during your prenatal appointment is blood tests. So a lot of blood tests are going to be done. This is just to check for blood incompatibility, so your blood group, and something we call resource factor. Resource factor is something that is found on everyone's blood cells. So some people are resource positive if they have that resource factor, and some others are resource negative if they don't have the resource factor. And if there is a mismatch or an incompatibility between yourself and your baby, this can result in jaundice and some other medical conditions. So that's why knowing ahead of time is good, so that your healthcare team can draw up a plan for you. Then another blood test that would be done is checking for sexually transmitted diseases like HIV, syphilis, hepatitis B. And then there's another one known as rubella. Rubella is not sexually transmitted, but it is a very deadly disease that can occur in pregnant women because it has a lot of complications. It doesn't necessarily cause death, okay, but it can lead to a lot of complications in your baby. That's why going for your prenatal appointment is very important, because I know some pregnant women, they say, oh, I'm not going to go for my appointment until maybe I'm almost due and all of that. Please, I would advise you to go for your prenatal appointment. It has a lot of benefits, okay, and it would really help your healthcare team pinpoint if there are any loopholes that they need to cover, any things they need to address before you have your baby. If you're struggling to cope with any of your symptoms, your prenatal appointment is a good time for you to discuss those symptoms with your healthcare team. They could offer you some medication, some advice, whether it's dietary recommendations, lifestyle modifications, whatever it is, they could really help you out. Then there are some things that you need to avoid, okay? You need to avoid alcohol in any form or shape or size, whatever it is, avoid alcohol at all costs. Then if you smoke, avoid smoking, okay? Because, I mean, it goes without saying, these things are really harmful to your baby. Then one other thing that you should avoid is hard drugs. So if you're taking hard drugs, please seek help. If you're smoking, drinking, or taking hard drugs, or even doing any other thing that could be harmful to your baby, please, I would urge you to speak to your healthcare team. They would have ways that could help you so that you and your baby can thrive, because I'm sure you want a healthy baby, and I want that for you. That is why I'm encouraging you to please seek help, okay? If you need help and you've not been able to get any help, let me know in the comment section, and I'm going to reach out to you personally and see how we can assist you in being a better version of yourself for your baby. Every woman's pregnancy journey is different. Some women might be lucky and go scot-free without any symptoms or with just mild symptoms, while some would be on the unlucky side and have a lot of difficult symptoms. However, it's best to know that pregnancy doesn't last forever. It can seem like a lifetime, but it is just for 9 months. No, let me not just say just, because the just is like, you know, trying to reduce it, especially if you're struggling. So it is for 9 months, and I wish you all the best. If you need any assistance, please let me know. I'm here for you. I'm here to support you throughout your pregnancy journey and even beyond. So if you have any questions, any comments, any thoughts, please drop them in the comment section below. If you found this video helpful, please give it a thumbs up so that it can reach more women, more men, more couples that would love this information, even more caregivers, okay? and I'll see you in my next video, which is going to talk about the 3rd month of pregnancy. Bye.